Good morning and welcome. My name is Ninez Ponce, and I am the director of the UCLA Center for Health Policy Research, principal investigator of the California Health Interview Survey, and Professor and Fred W. and Pamela K. Wasserman Endowed Chair in the Department of Health Policy and Management at the UCLA Fielding School of Public Health. As a land-grant institution, we would like to begin by acknowledging the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is, the Los Angeles Basin and South Channel Islands. Thank you for joining us. As we know, March is Women's History Month, but March is also National Nutrition Month. This is fortuitous timing for today's webinar, during which we'll be discussing a critically important issue, food insecurity in California. Data from UCLA CHPR's California Health Interview Survey, which we call CHIS, show that food insecurity is rising, and this is especially true for the poorest Californians. According to the 2024 CHIS, 47.2% of California adults earning less than 200% of the federal poverty level were food insecure. That means nearly half of the lowest income adults in the state could not afford enough to eat. This is a sharp increase from 2001, when CHIS data showed that 29% of adults in this income group were food insecure. For 25 years, yes, just as 25, CHIS has been an invaluable resource on food insecurity, offering detailed insights across different demographics and regions in California. Our findings have shaped news coverage, informed legislative action, and supported advocacy efforts aimed at building more equitable food and social policies. Recent federal government budget cuts to SNAP, known as CalFresh in California, as well as the discontinuation of the nationwide annual survey of household food insecurity, have faced state funding for CHIS food security measures in jeopardy. Allow me to introduce today's speakers. First, Dr. Sue Babby, Director of Research at the CHPR, and Dr. Joelle Wolstein-May, Research Scientist at the CHPR, will share what the data tell us about rates of food insecurity by race and ethnicity, sexual orientation and gender identity, regions in California, and more. They will also highlight how food insecurity links to health and other basic needs, including housing instability and income. We're also joined by Maxwell Titsworth, Chief Data and Technology Officer at the San Francisco Marin Food Bank, who will talk about the important work they're doing to understand and address food insecurity. I'd like to take a moment to thank the San Francisco Marin Food Bank for funding the expansion of the food insecurity questions in the 2025-2026 CHIS to also include households earning 200 to 400% federal poverty level, so we can better understand how food insecurity affects those earning above traditional poverty thresholds. And finally, we'll show you how you can access the data that you need. CHIS Data Dissemination Manager, Jacob Rosales, will walk through how to search for food insecurity data across demographic groups and regions using our free and accessible tools, Ask CHIS and Ask CHIS Neighborhood Edition. Next slide, please. As a reminder, today's webinar is being recorded and will be posted to our YouTube channel in the coming weeks. If you would like a copy of today's slides, please email our communications department at healthpolicy@ucla.edu. Thank you once again for joining us today. Now I'd like to turn it over to my colleague, Dr. Sue Babby. Sue?
Thank you, Ninez, and welcome everyone. We're very excited to be sharing this important information with all of you. First, we would like to acknowledge a few folks. We'd like to thank the CHPR communications team for their support with slide development, as well as webinar coordination and promotion. Also, we'd like to thank the CHIS team for all the work they do behind the scenes on the CHIS survey, as well as to make the CHIS data available and user-friendly. And finally, we would like to acknowledge the co-sponsor of this webinar, the San Francisco Marin Food Bank. So let's dive in. What is food insecurity? Food insecurity refers to not having access to enough food to lead an active and healthy life. Food insecurity can range in severity from being unable to afford balanced meals to skipping some meals and finally to going hungry. In the United States in 2024, about 14% of US households overall were food insecure at least sometime during the year. This amounts to more than 47 million children and adults in this country experiencing food insecurity. Nationally, food insecurity has been increasing since 2021. So we'll be highlighting some findings from the California Health Interviews Survey. CHIS is the nation's largest population-based state health survey. CHIS interviews more than 20,000 households in California every year from every county in the state. The survey collects information on health status, chronic conditions, health behaviors, and access to health care, as well as demographic and social characteristics. To better capture the diversity of California's population, interviews are offered in 7 languages: English, Spanish, Korean, Chinese, both Cantonese and Mandarin, Vietnamese, Tagalog, and new in 2025, Armenian. The data are weighted to be representative of the California population living in households. CHIS measures food insecurity using the short form of the U.S. Household Food Security Survey module. This is a validated set of questions for assessing whether all members of a household have access to nutritionally adequate food during the past year. In CHIS, statewide, only adults with incomes below 200% FPL were asked the food security questions. For the most part, we will be looking at food insecurity as 2 categories: food secure or food insecure. So what do we see? In California, 47% of adults with low income experienced food insecurity in the past year. This includes 19% who were food insecure with hunger and 28% who were food insecure without actually experiencing hunger. Similar to the national trends, food insecurity in California has been increasing since 2020. The rate in 2024, 47%, is significantly higher than that in both 2020, which was 36%, and 2021, which was 39%, and has been increasing since then. But how does food insecurity vary across different population groups? When we look at food insecurity by income as percent of the federal poverty level, we see that adults with the lowest income levels are disproportionately impacted by food insecurity. 51% of those living below the poverty level experience food insecurity, compared to 44% of those with incomes between 100% and 200% of the poverty level. Rates by race and ethnicity are high for all groups, ranging from about 1/3 of low-income adults to about 2/3. But some groups are disproportionately impacted by food insecurity, particularly low-income adults who are Native Hawaiians or Pacific Islanders, Black or African Americans, American Indian or Alaska Natives, or Latino, Latina. When we look at food insecurity by sexual orientation and gender, again, we see that rates of food insecurity are high across all groups. However, they are highest among lesbian, gay, bisexual, and pansexual low-income adults. When we look at food insecurity by gender identity, we find that nearly 70% of transgender or gender expansive low-income adults experience food insecurity, and this is significantly higher than cisgender adults who experience food insecurity at or 46% of whom experience food insecurity. At this point, I would like to hand the mic off to my colleague, Joelle.
Thank you, Sue. Hi, everyone. It's nice to be here. So Sue just showed you how food insecurity varies by common demographics like income, race, ethnicity, etc. But because of the range of demographic and social characteristics collected in CHIS, we can actually also look at food security by other less common demographic groups. For example, we can look at the rate of food insecurity among caregivers. 57% of caregivers experience food insecurity compared to 44% of non-caregivers. This map shows food insecurity by county. Those with darker shades of blue have higher rates of food insecurity. It's important to note that the lightest shade represents counties with a rate of food insecurity up to 40%. Those are counties with the lowest rates of food insecurity. And the darkest shade shows counties with a rate of 56% or more. This slide also highlights the percentages in a few counties, but overall the percentages ranged from 28% in Lake County to 66% in Sonoma County. Next slide, please. Food insecurity is also associated with other basic needs. For example, as you can see on the left, food insecurity is higher among low-income adults experiencing unstable housing. Specifically, 67% of those who felt their housing situation was fairly unstable or very unstable experienced food insecurity, compared to, sorry, my light went out, compared to 55% who said their housing was somewhat or fairly stable, and 34% who reported very stable housing. Looking to the right, food insecurity is also higher among low-income adults without health insurance. Specifically, 54% of those who were uninsured all or part of the year experienced food insecurity, compared to 46% of those who were insured all year. And finally, food insecurity is linked to health status. In this chart, the blue bar represents those who are food insecure, and the yellow bar represents those who are food secure. If you focus on the blue bar on the far left, you'll see that those who are food insecure are less likely to report having excellent or very good health status compared to their food secure counterparts. Specifically, only 29% of food insecure adults said they were in excellent or very good health, compared to 43% who were food secure. And looking at the blue bar on the far right, food insecure adults are more likely to report fair or poor health than those who are food secure. That's 36% of food insecure adults reporting fair or poor health status compared to only 24% of food secure adults. To summarize what we've shown you today, some groups are disproportionately impacted by food insecurity. We also showed you that food insecurity is related to other basic needs, including housing security and health insurance status, which facilitates access to care. And food insecurity is related to health, with those who are food insecure being more likely to report fair or poor health status. What's important to remember is that across groups, 47% of low-income adults in California, nearly half of low-income adults, or 4.2 million people, experienced food insecurity. This number is alarmingly high. And this measure can't tell us the total number of people experiencing food insecurity in the state because it's only asked of adults with incomes below 200% of the federal poverty level. If we could capture people with incomes above that 200% threshold, the total number experiencing food insecurity would surely be higher. Now, I imagine some of you may have questions about what Sue and I just presented. If you could please add your questions to the Q&A box, we will be happy to answer them for you at the end of the webinar. I'd now like to introduce Maxwell Titsworth, Chief Data and Technology Officer at the San Francisco Marin Food Bank. Guided by a belief that technology should serve people first, Maxwell focuses on building tools, insights, and systems that reduce barriers, improve participant experience, and support more effective community-led solutions. Welcome, Maxwell.
Thank you very much. I'm Matt Titsworth. I am our Chief Data and Technology Officer of the San Francisco Marin Food Bank. Just a little bit about our mission. Our mission is to end hunger in San Francisco and Marin, full stop. And we have a wide range of programs from food distribution to advocacy to CalFresh enrollment to support that mission. I want to contextualize a little bit about the scale of the food bank. We serve about 44,000 households per week through a network of about 260 community partner organizations. Last year, we distributed almost 67 million pounds of food, of which 70% is fresh produce. This is a little bit about our food programs. Like I mentioned earlier, we have many other programs and initiatives that we take on, from policy advocacy to CalFresh enrollment, supportive service work, etc. The range of the food bank is quite immense, and I'm really thankful and proud to work at the food bank. So I want to talk about how the food bank uses data. I am our Chief Data and Technology Officer, which means I am also our Chief Data Nerd. And that means that my job is to work with some amazing colleagues on our data engineering and data analyst side to make sure that we have the insights to drive programming at all levels of the food bank. And as we think about food insecurity, as we think about how we advance equitable program design, state and local federal policies, we really need strong data on food security trends. And so there are kind of these constant recurring questions that we have. What is the overall prevalence of food insecurity? How has that prevalence changed over time? And how does food insecurity intersect with demographic characteristics in the local context? And for us, we often turn to CHIS to answer these questions. And so I want to talk about two ways in which we use CHIS, both a current use case and a future use case, that are really important for food bank operations and our mission. So the first CHIS use case is one that was mentioned earlier, which is this demographic deep dive. We use the CHIS tool, the Ask CHIS tool, which you're going to learn about here shortly, to dive deep into food insecurity prevalence across race, ethnicity, age, and household size. Using the Ask CHIS tool, we will pull results over years, regional levels for subgroups, etc. There's a lot of different ways we can customize the analysis for our needs. And it's really useful for us to anchor to inequities in the food safety net. Who is being served, who is not being served, and how can we better meet the needs of those populations? And so I was at a conference last year about the future of public data, and I was sitting at a roundtable discussion on what are some tools that we should be looking to for inspiration as we think about the future of public data. And I raised my hand and said the Ask CHIS tool was the number one tool I recommend, just because of how clear and easy it was to use. The inclusion of confidence intervals and estimates of stability is really important for practitioners to understand how reliable the data are. And I really appreciate how detailed the methodology is online. So this is one of the ways in which we use the Ask CHIS tool to really dive deep into food security estimates across race, ethnicity, age, and household size, and intersections with other conditions. So that's one existing use case. The next use case is one that's ongoing and we're really excited about. And that use case is we've partnered with the California Health Interview Survey to expand the food security screeners to households between 200 and 400% of the federal poverty line for calendar year 2025 and 2026 in San Francisco and Marin counties. Right now, we don't really have a great understanding of food security at the middle income level. Most of the prevalence estimates, as stated earlier, focused on the low income household level. And for us in the high cost of living counties and region, we really need to understand what food security prevalence looks like at those higher ranges. And so we signed up for a 2-year partnership with results collected in 2025 and 2026. And I'm really excited to dig into those results in the next year. We as a food bank, we do see opportunity to expand this data collection statewide. That is not the topic of today's conversation. But if you do have questions or thoughts or want to hear our point of view, please reach out. So just in conclusion, we use the Ask CHIS tool on a regular basis to understand trends in food security and map directly to our work, which is really exciting. It is one of my favorite public data dissemination tools out there. And we have a partnership to expand CHIS to higher income households in San Francisco and Marin. And we're really thinking about the future of data collection with food security. So please reach out if you have questions, comments, or want to collaborate more. And now I'm going to pass it to Jacob Rosales. He is the data dissemination manager at CHIS, and he's going to walk you through how to access and search for data on food security using CHIS's free online health query tools, Ask CHIS, and the Ask CHIS Neighborhood Edition.
Thank you, Maxwell. Let me get my screen spun up to share. Okay, I believe it's presenting right now. This is the landing page for our Center for Health Policy Research. I'm just going to quickly show you how to access Ask CHIS and Ask CHIS Neighborhood Edition. From the center webpage, you can go to Our Work, California Health Interview Survey, and access CHIS data. And from here we have Ask CHIS Neighborhood Edition, Health Profiles, PUFs, DAC, Resources, etc. Another thing, something that I use is sometimes I'll just go straight to Google and I will type Ask CHIS or I will type Ask CHIS Neighborhood Edition and it'll take me directly to where I need to go to log in. That's usually the most expedient method. But if you're on the center webpage, all you have to do is go to Our Work, CHIS, and then access CHIS data. So we have more information about what we have in Ask CHIS. You can get more FAQs here and read more about Ask CHIS. I'm going to go take you directly to the Ask CHIS platform. I'm automatically logged in because I've already been logged in. But all you'd have to do if you wanted, I'm going to show you real quick for those that do not have a login. All you need to do when I go to take me directly, if I'm not logged in, like most browsers, it remembers my password, username, etc. You have a forgot your password, and then if you do not have an account with us, just create an account. It's really easy. Everyone's gone through creating accounts in multiple web platforms. Just enter your information, your email address, etc. You'll get an email to confirm, and then you can log in. So let's look at food insecurity in Ask CHIS. First off, the very first landing page shows you the geographic areas. By default, it's set to just search for all of California. Within Ask CHIS, we provide estimates for essentially we call them CHIS strata, but it's mostly all the counties. But you'll see that we have 3 grouped counties in the Northern California region: Tehama, Glen, and Colusa, and then Tulum, Calaveras, Amador, Inyo, Mariposa, Mono, and Alpine. And then we have Del Norte, Siskiyou, Lassen, Trinity, Modoc, Plumas, and Sierra. Everything else is all county specific. You'll also see that we have some sub-county levels here: Los Angeles County Service Plan areas. So you can get estimates for these areas, as well as San Diego County Health Regions. You can view a map of the San Diego HHSAs, as well as a map of the Los Angeles spas. Now let's select our topic. It's going to be food security. You have two ways to select it. You can either go by category or you can do a search, simple search bar, type in whatever you're interested in, food insecurity, food stamps, etc. For the category, what we'll do is we'll go down to public program participation, scroll down, and we have our food security variable here. Gives you information on this variable, the years that it's supported, what age group is included. This is adults. And then of the categories, so results are displayed in the following levels: able to afford enough food, food secure, or not able to afford enough food, food insecure. Also provide information on each year, giving you details. Information on universe restriction, asked of adults whose income is less than 200% of the federal poverty level. And then also what the corresponding source variable is if you were looking at, say, the public use file and you kind of want to match up or make sense of what we have in ASCHIS versus what we have in our public use files. Those are called PUFs. So I've selected my topic, and right now I'm just going to run a query on 2024 for the entire state of California. So I select Get Data, and now I get my estimate. You can run some charts. You can also trend. You hit this trend button and it will give you a trend of all the year's data in a line graph. You can also do pie charts here. Now, one of the good things about ASCHIS is that it allows you to not only just get kind of like a singular estimate table, but you can do cross tabulations. So we're going to compare topics. Here, I'm going to look at race and ethnicity. So I'm going to go down to my demographic. And again, when you do compare topics, it's just very similar to when you select your topics. You can do a category search, or you can just do a regular search. I'm just going to go to demographics, race and ethnicity. And I'm going to select the race OMB Department of Finance. You see here we get more information on it. So we see that the results are displayed for the following levels: Latino, white, non-Latino, Black or African American, non-Latino, et cetera, et cetera. I'm going to get the data. It's going to start loading. And now you see here, I get a pop-up here saying statistically unstable. And essentially it tells me that I have some unstable estimates in this. So instability in ASCHIS is defined as any estimate that has a coefficient of variation that is greater than or equal to 30%. And it'll explain this, and it'll give you some strategies to do to address instability. It'll suggest pooling years, so combining multiple years of data to create a larger sample size so that you get a more stable estimate, or collapsing topics together. And if you don't want to see this message anymore, you can check this. You can check this box here. I'm going to do that real quick. I'm going to say OK, and you'll see here that for my Native Hawaiian Pacific Islander in 2014, I have an unstable estimate. And I also have a suppressed data cell, and that's suppressed because of sample size. So what I can do to address this instability is I can pool multiple years of data together, and that's what I'm going to do. I'm going to select years, and I'm just going to pool 2023 and 2024. You see we have these radio buttons. Compare. I don't want the compare. I want pool. So I'm going to select pool. I'm going to get the data. And now you see I have no longer any asterisks on any of my data cells. So everything is stable, and we can see that across the board. These are the same estimates that were presented earlier by Dr. Babby, where we see the breakdown. So we see here we have like 69% of Native Hawaiian Pacific Islanders that were below 200% FPL that are food insecure, and we can compare that by the different groups. You also have the ability to limit the population. I like to say filter. So if I wanted to do a population limitation here, we have 4 different variables that are just kind of like easy to do. You can do by age and years. Remember that this variable here is adults only. We do not have any child or teen data for food insecurity in ASCHIS. So if you wanted to do a specific age group, like maybe you were looking at like the retired population, you could say 65. And you'd see here that like in the limit population is going to say 65 to 106. So it's essentially saying those that are 65 and older. We would leave it as include all ages. We could focus solely on male, solely on female. If we just wanted to whittle down one specific race ethnicity group in the OMB Department of Finance race variable, we could. Or if you were specifically looking at federal poverty level, so maybe you wanted to go only those individuals that are below 100% FPL, I could type 99 there, and then that'll give me those that essentially are below the poverty threshold. So it gives you that ability to kind of make your own unique kind of FPL range, however you define it. For also keep in mind that for these limit populations, it's not just based off of these four variables. You can create a limit population filter based off of other variables. So if you want to do it specifically on, say, maybe transgender, if you want to do it on any kind of socio-demographic or any variable that we have within AskChiz, you can just do a search here and you can select it by that in a specific category. It's a search function. You can go through there. The most important thing to remember when you're doing the population limitation or to compare topics is that it has to be a variable that is in the same year as the year of the data that you're looking at. So maybe you're really interested in mammogram data, and we do have variables for mammograms, but it's only for a specific year. You have to make sure that they match, because if you're looking at 2024 and you try to do the mammogram, it's not going to work because we do not have any mammogram data for 2024. So that's something really important to keep in mind. I'm going to delete this, rerun my data table real quick, and also show here you have a compare geography. So you can compare across counties, and what this will do is it will just create a massive table showing all of the Chiz County strata and these estimates. And so now you see I have, and here's where you're going to get a lot more instability. You see we have the red asterisks, and this has to do with sample size. So if I'm working on something like this, I'm going to probably pull more than 2 years of data, probably 5 or 6, sometimes 10 years of data, especially with this because it's based off of 200% FPL and below. You're probably going to want to use, if you're looking at specific counties, and especially the rural counties, you're going to want to pull a lot more years of data so that you can build your sample size and have that power to have a stable estimate. And go back to the entire state. And also point out that you can do a simple export. You can export this as an Excel file, and you can get it as an Excel downloadable Excel file. It'll give you the information on what the universe is, what you're looking at, and then you can manipulate it if you want. If you want to create your own custom charts and figures. That is AskChiz in a nutshell. There's a lot of power with this. You probably have questions about running analyses by different variables and whatnot. I wanted to keep this very specific to just using food insecurity. If you have further questions, we're going to provide you links to other webinars that are hour-long AskChiz Neighborhood Edition specific that might be able to answer your questions, or you're more than welcome to email us at chiz@ucla.edu for further questions that you have on using AskChiz. Now I'm going to real quick move over to using AskChiz Neighborhood Edition. So go back to our work. California Health Interview Survey. Access the CHIZ data. Go to Ask CHIZ NE. Info on what Ask CHIZ Neighborhood Edition is. Read more about Ask CHIZ NE. Learn about methodology, FAQs here. Let's go straight to the dashboard. Now, keep in mind when you have a login for Ask Chiz, it's going to be the same login for Ask Chiz Neighborhood Edition. So once you're logged in and using Ask Chiz, regular Ask Chiz, you'll be able to access Ask Chiz Neighborhood Edition. The login is the same for both. Real quick before I jump into Ask Chiz Neighborhood Edition, I want to explain some things about methodology and also the differences in universe that we have for food insecurity. In Ask Chiz, those estimates are direct estimates, direct weighted estimates from the Chiz survey. In Ask Chiz Neighborhood Edition, these are modeled small area estimates. We use multiple years of Chiz data. We model the estimates leveraging the American Community Survey and Claritas data to develop more granular estimates at sub-county areas such as census tracts, zip codes, cities, counties, and legislative districts. Those legislative districts being congressional districts, state assembly, and state senate districts. We have some quick little videos on how to use videos for Ask Chiz Neighborhood Edition. Let's get started. Let's go straight to create a map. By default, it's going to run a map showing the state of California, all the counties, indicator that it shows us for asthma. So I'm going to select food insecurity. Now, in Ask Chiz Neighborhood Edition, the food insecurity variable is provided for all adults. You'll notice in Ask Chiz, it is adults 200% FPL, below 200% FPL. For Ask Chiz Neighborhood Edition, because it's modeled estimates, we had to do it for all adults. So you might see like, wow, the food insecurity is a lot lower in this county in Ask Chiz Neighborhood Edition versus in Ask Chiz. And the reason why is Ask Chiz is looking only at adults that are less than 200% FPL, whereas Ask Chiz Neighborhood Edition, it's looking at all adults. Have my map generated. As I hover over the different counties, you'll see I get a little tooltip pop-up giving me information on what the geography type is, what the year is, what's the indicator, adults ages 18 and older who are low income food insecure, what the estimate is, what the 95% confidence interval is, the population total, and then also have these two widgets. Please note, when it says race and ethnicity, this is not showing that 60% of non-Hispanic white only are food insecure. It's showing that 60% of the population, of the adult population 18 and older, are white, non-Hispanic. Likewise, here when we see the widget for federal poverty level, this is showing the federal poverty level estimates for this specific geography. If I click on a polygon, I click on an area, I'll get Inyo County and it'll show me. I can combine geographies. So if I want to look at, say, Imperial County and San Diego County, if I do Control and click on both, we'll essentially create a user-defined geography group, and it'll combine that estimate to show me that those two counties combined have an estimate of 3.6% adults that are low-income food insecure for that specific grouping. We have drop downs here that you can select by different types of geographies. I can go to census tract. And now you'll see here that it's much, census tracts, especially in like the Los Angeles area, San Francisco area, they're much, much smaller. I can zoom in, get a closer look. I also have a widget here where I can search. I can go to specific areas. So if let's say I wanted to look at Venice, or let's say Santa Monica. It will zoom me into Santa Monica. I'll get different estimates for this area. And again, if I want to create custom neighborhoods, because again, these census tracts are very small. Maybe I know specific census tracts I'm working with. I can select multiple tracts. and essentially define this specific area as kind of like this is my neighborhood based off of these tracks and get a pooled grouping. So here, these four tracks I selected, I have 9% low income food insecure adults. Also, you'll notice that the track names are, Los Angeles County Track 2197. A lot of times people don't know specifically what their census tract is. They know what their zip code is. They might not even know what their legislative district is. We have an address lookup tool here. You can type any address as long as it's an address within California, and it'll give you information on what the track name is, what your legislative district is, etc. Please use that address lookup. That's very useful. You have a drop down showing the different years. Please note when you're looking at census tracts, we only support census tracts from 2016 to 2022. You can also create a table. I'm just going to briefly show you the create a table. I can include food insecurity. I can include a multitude of different indicators that we have in here. We have sociodemographics. We have indices from other databases. Um, um, different indices as well. And then you can export the data into an Excel file, clicking the Export Data button. So please, I know this is very kind of a brief intro into using AskChiz Neighborhood Edition. We'll have those links to the different webinars. Please use those. Ask questions in the Q&A, and then if you have like really specific questions on more navigation or different types of analyses you can do, by all means, send us an email at chiz@ucla.edu. Thank you. And now I'm going to pass it over to our Center Director of Communications, Tiffany Lopes.
Thanks so much, Jacob. And thank you to all of our presenters for packing so much great info into 43 minutes. I'd like to ask all the panelists to turn their video on for Q&A. And I'd also like to welcome our California Health Interview Survey Director, Todd Hughes, who will be here to answer questions as well. We are getting a lot of questions, so please bear with me while I get through some of them. Excuse me, some of the statistics cited talk about households, and Jacob had mentioned that the data is only for adults. Is the data for the children in these households intentionally filtered out? We do have several questions about child and adolescent data, so if we can get those all answered as well, that'd be great.
I can take that, Tiffany.
Thanks, Joel.
So CHIS is a household survey, and an adult in the household can answer questions, but if there are teens in the household, one team is randomly selected and invited to participate in the survey, and the same goes for children. So any measures of food insecurity are household level variables, but we can link them to the specific children or teen outcomes. So they're not asked directly to the children or teens, but they represent the household food security status.
Thank you, Joelle. For AskChis data, even if we have tried to pull several years of data, but we still get instability, do you have any recommendations on how to approach?
I think this happens a lot, especially when you're trying to cut it down by like smaller rural counties. I think for food insecurity, you're probably going to have to, especially if you're looking at one of the smaller rural areas in Northern California, you're most likely going to want to pool 15, maybe all the years of data together. And then if it's still unstable, I think things that you can do is maybe try to combine multiple counties together to create like a larger, essentially you want to create a larger sample to give you more power. Because the thing it does is when you look at the California estimates, that's like looking at all the data. And then if you look at, say, specifically let's say Humboldt County, that's really whittling down the data and it's really whittling down your sample size. So in my head, based off that question, it's probably sounds like you're either cutting it down by a smaller, you're cutting the sample size down a lot, and it might be because maybe you're focused on, say, NHPI in Humboldt County. I have a sneaky suspicion that it's not a very large population, or if you're looking at, say, um, transgender, again, it's going to really whittle down that population. So I think that those are things that you're going to want to consider. You're going to want to consider, essentially using kind of like a proxy, some sort of proxy variable that's, essentially making the determination based off your analysis and you as a researcher of like, is this good enough? Is this proxy good enough?
Thanks, Jacob.
Mm-hmm.
We've got a lot of questions about federal poverty level and what that means and who is asked the questions. Sue and Joelle, can you talk about who is asked the food insecurity questions, please?
Yeah, happy to do that. So on CHIS, statewide, adults with incomes below 200% of the federal poverty level are asked about food insecurity in their household. The San Francisco Marin Food Bank has paid for those questions to be asked in those counties, San Francisco and Marin, of adults with incomes from 200% to 400% of the federal poverty level. However, we don't have those data yet. They're being collected now. And the reason that the questions are asked of those with lower income is because those are the groups who are more likely to be experiencing food insecurity and more likely to be eligible for food assistance programs that have income requirements like CalFresh.
Thank you, Sue. Maxwell, we have a question for you in the chat about policy, specifically bills being introduced to California this year. Someone asked about AB 1734, which is set to expand food insecurity survey and partner with CHIS. Can you expand a little on that bill and how it will work?
Sure. Yeah, I know this is not the subject of today's conversation, so I'll just say very briefly that part of our vision for the future of food security data collection is in collaboration with the California Health Interview Survey. We have a pretty strong point of view here in working with local elected officials on this. Again, not the purpose of today's conversation. So if you have questions about our initiatives there, I'm happy to take those offline at my email address, and we'll share that in the chat again. Thanks for asking the question.
Thank you. Sue, we have a question from someone about, as an expert on food security, can you speak to how food security differs from access to nutritious food, such as how this is measured in the Modified Retail Food Environment Index, and if food insecurity should be emphasized over nutritious food access, why it should be emphasized? As my understanding is there has been a recent shift in emphasis, which I don't fully understand.
Yeah, thanks so much for this question. I love it. So I think first, food security is really just about whether people can afford enough food to feed themselves. There are some questions that reference whether people could afford balanced meals, but that's really the extent to which food security gets at whether the quality of the meals. And it doesn't, it's related to, but separate from whether people have access to nutritious foods, which is more about, in how easily can you find food that isn't fast food, that isn't convenience food, that is fresh and healthy, and how much do you have to pay for that food, which relates back to the food insecurity piece. Because if it's too expensive, then people can't afford it, and they either turn to lower quality food, which is cheaper typically, or they can't afford enough to feed themselves adequately. I don't know if that fully answers your question, but I do see those two concepts as both being really important and highly related to each other. But the access piece is really about what can you easily get your hands on versus what can you afford to buy to feed yourself.
Thank you so much, Sue. So we've got several questions coming in from folks about what we can filter by. And so I'm going to go through a couple and uh, Jacob, Sue, Joelle, please feel free to uh, chime in. Have you explored food insecurity by language spoken at home?
I can take that. We have not, we didn't do that specifically for this webinar, but certainly using Ask Chis, you can do that. And I encourage you to do so.
Definitely. I had a fun time exploring Ask Just myself. Spent several hours looking at food insecurity across a range of demographic factors. So if you do have questions, you can also email us at healthpolicy@ucla.edu because we may have that data already available or we're sharing it on social media. So follow us on social media. What about household type? For example, households with children, single parent households, etc.
Yeah, so there is information collected on the survey about family type, which gets at, whether folks are married or single, whether they have children or not. So you are able to look at households with children in them, for example. But again, we didn't look at it in this particular case. But if you are interested in a particular characteristic or way to look at food security, let us know. We're happy to help you find that information if we can.
Absolutely. We also have a question about age. Is the data available for seniors 65 years and up? Yes, the answer is yes. There are different age breakdowns too that you can use in AskChiz, which is really great. It doesn't just need to be 18 to 64 and 65 plus. So it's really interesting when you start looking at the different age groups and the way food insecurity affects people. This is kind of a big question. What are the future plans for CHIS in measuring food insecurity?
I assume the panelists would like me to perhaps answer that question. I'd be happy to speak to it briefly. So we are right now going through the process of working with all of our various funders to identify topics for the 2027-2028 CHIS cycle of data collection. We don't get a final verdict on what each funding organization would like to include or whether there's support for a given topic or not until the end of July is our deadline for this 2-year cycle. So by the end of July this year, we hope to have resolution on this. I hope that that will include funding for food security questions to remain. I know in the past there's also been some, potential suggestions to enhance with additional nutritional security information questions on the CHIS as well. So we don't have current funders who've stepped forward on that topic specifically for this cycle. The funding for the food security questions, is a topic of ongoing discussion. We hope that it gets resolved with clarity by the end of July.
Thank you so much, Todd. Jacob, at one point when you were doing the Ask Chis demo, you talked about filtering by different variables. Folks are asking, how do they know what variable options there are?
So essentially, what you can do is the variable options, when you go in Ask Chiz and you see the topics, those are all the different variables that we have covered through Ask Chiz. So if you're looking at food insecurity, you can, and the great thing about our food insecurity variable is that it's covered pretty much every year. So you can go in and see, you can do the search bar. There's, as I was going that the filter topic area. Um, you can go, there's a search bar and you can type in anything there. Like, you could look in, if you wanted to look at access, we have access to guns, we have hate crime, hate incidents, etc. Like any of those variables, you can run those and you can filter it by those specific variables. So a lot of it is just kind of getting to know what's in Ask Chiz. I highly one thing that I do is get yourself very familiar with those topic areas. Look at those different categories and look at those different variables that we have in those categories. And then you can start to think like maybe I want to do a crosstab by this specific variable. Maybe I just want to limit my population by those people that reported that they keep a firearm unlocked in their house or whatever it is. Obviously some of the indicators aren't really relevant to food insecurity, but there's some that really are. And so I think it's kind of like it's just a lot of pecking around and playing with it. I guess is the best response. And again, if you have questions on how to do that and how to navigate it more, highly recommend looking at our more comprehensive data user webinars that focus on Ask Chiz and Ask Chiz Neighborhood Edition, or email us at chiz@ucla.edu, and I'll be more than happy to walk you through things and give you some specifics and send you screenshots, etc. Thank you.
And I will post that email address in the chat for folks who need it. So we have time, I think, for a couple more questions. And I do want to know, as Jacob had mentioned, there are so many variables. And, this was a very short demo. But with Ask Chis Neighborhood Edition, we've had folks ask about regional differences. You can really drill down to, census tract level and look at, the needs of your specific, county or district. And if you do have questions about that, we have those tutorials available. I can repost those links in the chat as well. And you can always reach out to us. Is there a way to look at food insecurity by financial insecurity, not just FPL? Because the FPL, which is federal poverty level, is an outdated measure that doesn't really capture financial security like other measures, such as the family self-sufficiency measure or the real cost measure.
So that's a great question. I certainly agree that the FPL measure has many drawbacks and limitations. And I think, so CHIS doesn't specifically collect the information that I don't think that would be needed for those other specific indicators of financial insecurity that you mentioned, but it does collect other information that I think gets at similar issues. So there are a number of questions about housing insecurity, including questions about whether you have problems paying your rent, making mortgage or rent payments. There are questions about medical debt, which also feeds into financial insecurity. So there are other ways that you can look at this and get at financial stability more generally than just the FPL.
Thank you so much. So we do have time for one last question. Jacob, can you explain what statistically unstable means? Can we share data and reporting that is statistically unstable?
So for Ask Chiz and Ask Chiz Neighborhood Edition, we define statistical instability as an estimate that has a coefficient of variation that is greater than or equal to 30%. We will flag that as being an unstable estimate. You can view that, you can use that, you can report on that. Highly recommend that you also report that this is an unstable estimate. That's essentially how we are defining instability. I think that, as I mentioned, especially with Ask Chiz, we do have means to kind of like rectify instability that you can pool multiple years of data, or you can collapse topics together to try to like build up your sample power. So maybe you want to focus solely on 2024 data, and you see, oh, this estimate for this specific county is unstable. I would recommend pooling 2 or 3 or 4 or 5 years of data together to kind of build up the power. And then when I would report on that, I would say this is a pooled estimate of CHIS data from 2020 to 2024. Something to that extent, to kind of like provide the details, kind of similar to like if you're reporting something from the American Community Survey. You have the ACS 1 year data, and then you have the ACS 5 year data. I would kind of go in a vein similar to that. That's how I recommend folks report on the estimates that they get from Ask Chiz.
And can I just add something to that,
Go
Tiffany
ahead,
and
Sue.
Jacob?
Of course.
I think the other piece of information that you might want to look at that is available on Ask CHIS for estimates that are flagged as unstable is the confidence interval. And what that is going to tell you is sort of the range at which we're fairly sure that the point estimate falls in. And the bigger the range is, the less confidence we have in how precise that estimate is. And so a smaller range means we have more confidence that the estimate is pretty precise. And that can just give you a sense of, if you find an estimate of 18%, but it ranges from like 0 to 56%, that's a pretty big range. And that means there's a lot of uncertainty about that 18% estimate.
Thank you, Sue. It was a great ad. So we are 2 minutes over. I want to thank everyone once again for attending, and to all our presenters, thank you so much for a great discussion. I think we got through at least 25 questions, and there are about 40. If you do have questions and you want to email us, you can email me at healthpolicy@ucla.edu, and I will forward your email to the correct person. This event is being recorded and will be posted online. If you want a copy of the slides and a link to the recording, please shoot us an email and we can send that over to you. Thank you everyone so much. Maxwell, thank you so much for joining us, and thanks to the San Francisco Marin Food Bank for being a part of this great event. So I appreciate it, and have a great rest of the day.